Hello, everyone, and thank you for tuning in to this very brief case study on thrush. We're going to talk specifically about the use of probiotics and oral thrush, kind of like this case you see right here. My name is Jerry Simons. I'm an assistant clinical professor at Stony Brook, an advisor for the Southampton Hospital Regional Tick-Borne Disease Center, and I'm a PA at the Morrison Center in New York. So here's a brief description of our case that we're dealing with in the trenches. 38-year-old active mom and a hiker. The fall of 2020, she had 3 deer tick bites after visiting Montauk, New York, the end of Long Island, very endemic area for Lyme, and her PCP gave her 2 doxy. Late in the winter of 2021, now January, February, she developed shooting pain, joint pain, easy exhaustion, memory problems affecting her daily function. And her full family practice, primary care physician and rheumatologist did full evaluations, said she was all normal. Later in the winter, she developed bronchitis. Her COVID swab was negative. She was treated with Ceftin, a 3rd-generation cephalosporin, which helped her bronchitis, but she got 10 days of joint pain, joint swelling, shooting pain, and started to need 4-hour naps. By the spring of 2021, she still wasn't feeling good, with joint aches and swelling, feeling tired, so she came to see me. Her main complaints were joint swelling that comes and goes, tingling, especially at night, headache, and pretty persistent fatigue all the time. She met a lot of the CDC early signs and symptoms for Lyme disease, including headache, fatigue, muscle and joint pain, even though these are typically what we might see in the first month after a tick bite. Her physical exam was pretty benign. She was a little dehydrated, heart, lungs, abdomen, skin, neuro exam, and our blood, including B12, thyroid, liver, kidneys, urine, all fell within normal range. Her Lyme disease test did show a positive in the 2-tier protocol. This is about being sick for about 6 or 7 weeks. She had a reactive ELISA and then a positive IgM Western blot, pretty significant numbers there. So she met the CDC Lyme disease criteria, including having the signs and symptoms, exposure to black-legged deer tick, and blood test was helpful, even though the CDC does not strictly require blood work to diagnose Lyme. So I started her on doxycycline, 100 milligrams twice a day for a month, along with fish oil, probiotic, and a low carbohydrate diet. 6 weeks later, she came to me having done a month of doxycycline, and she still didn't feel good. Headache, neck stiffness, muscle joint pain, some knee swelling, dizziness. She still had that shooting pain, especially at night, and continued problems with short-term memory. So this patient met a lot of the symptoms, later signs and symptoms the CDC describes with Lyme. We remember that according to Harrison's Principles of Medicine, Borrelia burgdorferi, the Lyme bacteria, is a pretty strong and unusual bacteria in their term. It's a microaerophilic bacterium, low oxygen, high carbon dioxide it loves. I had another example of a patient who had ambulatory surgery in the PACU. She was given high flow oxygen and that cured her headache. That's going to be a different in the trenches video. The most remarkable part of the Lyme germ is that there are sequences for more than 100 known or predicted lipoproteins, more than any other organism. This part of Harrison's internal medicine always reminds me that patients can have multiple overlapping Lyme disease infections. So if doxycycline doesn't help, amoxicillin or a cephalosporin may. And remember, this was the lady who responded very strongly to Ceftin just a few weeks earlier. With the wide variation in Lyme bacteria presentations and the many different gene sequences, I then decided to start her on amoxicillin or Ceftin, now knowing that she might be getting into that vortex of more persistent Lyme disease. She probably fell into this 10 to 20% of patients that they describe at Stanford where the disease can actually persist. So Harrison's principles, Stanford, CDC late Lyme disease, there's a lot of great data that shows that Lyme can definitely persist. So I started this patient on amoxicillin, 500 milligrams 3 times a day for 3 weeks, and she felt worse after 10 days of therapy with more memory loss, more joint pain, and joint swelling. So she really met the criteria for this Herxheimer reaction, which a lot of people talk about, and is a great description of the Herxheimer in current medicine diagnosis and treatment. It's most famous in syphilis, but we do see it in Lyme. And it's more than just like a die-off reaction. It really is immunologic, inflammatory, and very multifactorial. Now, going through this amoxicillin treatment, by day 15, she was complaining of gassing, bloating, vaginal itching, but no discharge. And she really developed significant oral thrush, similar to that earlier picture that you saw. And she was found not to be following any of the low carbohydrate recommendations, eating bread and rice and everything. And now her joints weren't bothering her nearly as much as her oral thrush was. So I had her get the gut microbiome restorer, Omni-Biotic AB, which has a great variation in lactobacillus, Bifidobacterium, and Enterococcus. I think that's what makes this pretty unique. And I had patients with thrush do half and half. Half a packet in water and drink it, half a pack on the tongue, and just let it kind of soak into the mouth over time. I also reminded her of the low carbohydrate diet was essential. Keeping it gluten-free is kind of an easy way for a lot of patients to look at it. And a great study from cellular and infectious microbiology remind us that the Borrelia germ is an obligate germ. It requires us to eat zinc, manganese, copper, a lot of these transition metals. A lot of my patients come taking a lot of these supplements, and I give them this article and I remind them that you're probably just feeding the germ. So I had her avoid zinc, manganese, and copper specifically. Thank you for listening to this great case study showing the benefits of the 50-50 Omni-Biotic, half drink, half on the tongue. Remind your patients, especially those on antibiotics, enforce the low-carb diet, enforce probiotic use. Fermented food also is great. And I typically have patients now routinely, at least a couple times a week, putting some of the Omni-Biotic topically right on their tongue. Thank you for your time and listening to this brief presentation. And you've got my email there if you have any questions or thoughts. And look for more In the Trenches patient studies coming soon. Have a great day and stay away from the ticks.